Thank you so much, Dr. Farzaneh, for the mechanism perspective. That was very insightful, and it certainly goes a long way to understanding the pathology and the treatments. So we do have more questions. As far as is nanofat preferred over MFAT for scar tissue treatment because the nanofat is mostly SVF and thus higher has a higher number of MSCs?
Yes, I'm assuming that question is for me, and the answer is
Yes, yes,
yeah.
Dr. Miller.
And the answer is yes, no question about it.
Okay. And then I was curious, so in the MSK field in particular, there is a growing consensus now in terms of platelet dosing and the standards are a little bit more defined. And I was wondering if there is something similar happening in the cosmetic surgery field or reconstructive surgery. Are you starting to see any kind of platelet dosing standards emerge?
No, I mean, I would say that the concept of even combining PRP, platelet-rich plasma, or protein-rich PRP, and nanofat is not really something that is well understood by the vast majority of plastic surgeons and or dermatologists for that matter. So, we are working towards developing some standards for that, but at this point, there's so little experience with those biologics in the world of plastics and dermatology that they're very far away from, developing some kind of a standard dosing schedule. The other thing that is difficult is that you say a dosing schedule, but then is it related to the quality of the PRP itself? If you
Mhm.
say, should it be 20% PRP and 80% nanofat? What kind of PRP are we talking about? Is it a PRP with a 1x platelet concentration? Is it with a 15x platelet concentration? So there's a lot of variables and a lot of unfamiliarity. So at this point, there is not any specific protocol or regimen, and we hope to kind of move towards that so that we can give some standards in the industry for other practitioners to be able to, reproduce the results that we're seeing.
Great, thank you. If we have any more questions, now's the time. I know we're a little bit over, but feel free to send one last question in. And I can quickly do some announcements before we wrap up this evening's session. And let me just go ahead and share my screen really quickly. Can everyone see the screen?
Yep. Yep.
Great. First, upcoming events. We're having a Precision in Motion conference, and it's going to be held at the Gulf Coast Biologics Conference Center in Fort Myers. And it's going to be the first weekend in May, the first to the second. The topics that are going to be covered are adipose harvesting, bone marrow aspiration, nerve hydrodissection, spinal injections, and ultrasound guided injections. So head to the Gulf Coast Biologics website and register. These are our faculty who will be there. Dr. Miller, of course, will be there. And we have Michael Meng, Dr. Farzaneh, Dr. Rowan Paul, and Dr. Irizarry Roman. So please go to the website, Gulf Coast Biologics, and sign up for this conference. It's coming up soon. There's also free ultrasound training held at GCB monthly. You can always go online as well, register. And once again, let me just remind everyone these are free, so please take advantage of that. Uh, Dr. Miller talked about using the protein-rich PRP in combination with a nanofat for scar treatment. To make that protein-rich PRP, this core ultrafiltration system is key and is available in two sizes. These can be ordered through M-Site sales. And of course, the concentrating systems from M-Site. Please note, M-Site will be switching over to primarily the pure super physiologic concentrating systems with the Aspiridome technology. We're switching over exclusively for preparation of pure PRP and pure BMAX. So please switch over now. You will not be disappointed. It's a fantastic system, as I'm sure many of you have already encountered it and you're familiar with it, and it works fantastically well. So please switch over as MSite switches over. We also have the MSite Power Sales app. I have a brief video that explains how the app works. I'm gonna just show that now, and that will fill you in on how this app works as far as ordering through MSite.
MSite has launched the new Power Sales mobile app, making it even easier for you to manage your biologic orders and resources right from the palm of your hand. You can download it today from the Apple App Store or Google Play. To get started, simply use the Enroll feature so we can set your perfect price and securely connect you to MSite Biologics. Once you're inside, you'll notice it brings all our most powerful tools directly to your phone. Just by tapping the icons, you can instantly shop for products, access valuable resources, including clinical publications, instructions for use manuals, and processing videos. Or open the new PRP Calculations tool. P-Calculator, simply enter your baseline and result information, and the app instantly provides your yield, concentration, and deliverable cell content, eliminating manual math completely. You can also tap into MSite Data Biologics to easily track patient outcomes. The software sends automatic pain and performance surveys straight to your patients, and it's completely free for MSite users. Need to report an experience? The complaint feature lets you submit details and shoot a video right on the spot. If you'd still prefer to use a computer, no problem. All Power Sales features are fully operational online at msite.net. Download the app today on iPhone and Android.
All right. Thank you. So we'll stop there with announcements. And if there are any more questions, let me check really quickly. Yes, we do have a couple more. So one question is, Dr. Miller also, where can the blunt tip cannulas be sourced? Does it require a stab incision to introduce into the skin?
Yes, well, actually, I usually use like an 11 blade to just do like a tiny little nick, and typically those are not even closed with sutures because they're so small. And the blunt cannulas that we're using are manufactured by Tulip Medical in San Diego, and I know that that MSite and Tulip have a strong, long time working relationship. And the single-use disposable blunt cannulas are definitely the way to go for these procedures. I think it improves the clinical outcome and also, the safety factor and not worrying about infections like mycobacterial infections and things like that. So the single-use disposable cannulas from Tulip are really good to use, and I typically will use their disposable infiltration cannula, the disposable Miller harvesting cannula. That's to get the adipose tissue out, and then the nano transfer system and the lord-to-lord transfers, and then for the actual injection subcutaneously, I will typically use a 17 gauge Tulip injector to inject the combined biologic of protein-rich PRP and nanofat using that 17 gauge cannula with a specified ratio, and then just injecting that into the subcutaneous tissue underneath the scar itself.
Thank you. And one final question again, Dr. Miller. Have you noticed any success with flexor contractions of the fingers with PRP and nanofat application?
Absolutely. This is going to be a revolutionary treatment for Dupuytren's contracture. I'm a hand surgeon also by trade in Texas when we were doing, these really horribly morbid procedures to try to release patients' Dupuytren's contractures with Z-plasties and lots of grafting and lots of morbidity. these were really, really difficult procedures for the patients to tolerate. Now we're basically taking nanofab PRP, maybe doing a little bit of lysis of the scar tissue with just a needle subcutaneously under the skin. But for the most part, the biologic is really anti-fibrosing the area and resolving and curing basically the Dupuytren's contracture. So I do think that that is something that's very exciting and on the forefront, and it fits perfectly with the biologic properties that we're that we're talking about. And also, I just want to comment because I don't know that I'll get a chance at the end, just to thank Sina for the scientific approach, and understanding, because when I see those slides, it really makes me understand, what it is that I'm doing, physiologically. And even tonight, I learned some really great things from Sina. So I think, having the basic science and the scientific input is really key, because we're not shooting in the dark. We're really understanding physiologically what's happening. And every time that I interact with Sina, I learn more about the physiologic processes and maybe even how to modify our treatment. So I just want to say a thank you to Sina as well.
Thank you to you, Dr. Miller. You are always my mentor.
And then vice versa as well.
Thank you so much to both of our speakers. Those were excellent presentations, truly groundbreaking. And as you mentioned, Dr. Miller, the textbooks will have to be rewritten. And I think this is a good note to end on. Thank you so much, participants, for attending. And we hope to see you at the next webinar series. Thanks so much, everyone. Have a great evening.
Thank you for joining us in this session of EMsight's webinar series. Stay tuned for our next episode as we continue uncovering the science behind precision biologics.